Hi, it's Sonia Jensen here from Jensen Insurance Agency. Today I want to talk to you about
Medicare Part D had some big changes in 2023, and more are anticipated over the next several years. But for now, let's dive into the 2024 Part D coverage phases. I'm Sonia Jensen. Today's video will teach you how and why your drug prices change throughout the year, even on your Part D drug plan. Let's take a look. Here's a visual description of the 4 phases of Part D prescription drug coverage. I know, it's a lot to look at. So let's take one phase at a time. It is important to note that whether you have a standalone Part D drug plan or a Medicare Advantage plan with Part D, they have to follow the same guidelines. So let's talk about the deductible phase. Every January 1, the Part D deductible resets. Medicare has set the maximum Part D plan deductible in 2024 at $545. Just a quick reminder, a deductible is what you owe before the insurance carrier starts to pay. So, if your plan has a deductible, you will owe the full cost of the applicable drugs until you meet that deductible. I say applicable drugs because not all drugs will necessarily be subject to the deductible. Some plans will have a $545 deductible on all drug tiers, while others only have a deductible on brand name tiers. And there are even some plans with no deductible. Next up is the initial coverage phase. Assuming your medications are covered on the plan's formulary list, this is when your Part D plan begins to pay the bulk of drug cost. It's tier-based pricing. Typically, generic drugs are Tier 1 or Tier 2, and then brand name drugs are Tiers 3, 4, and 5. You will pay a copay or coinsurance percentage until you reach $5,030 of total gross drug costs. These gross costs are what the drugs actually cost, not just your portion. So, if a drug's full retail cost is $500, but you only have a $30 copay, the full $500 is applied towards reaching your $5,030 amount, which gets you into the next phase of Part D, the coverage gap, also known as the donut hole. Now, if you have a very expensive drug, then you can reach that donut hole very quickly. The donut hole phase of Part D has changed quite a bit since Part D began back in 2006. In 2024, you owe 25% of the full cost of each of your medications in this phase. This is the same as in 2023. For some drugs, like generics, the cost may not change much. For other drugs like brand name and specialty drugs, the cost could go up substantially because you're now paying 25% of the full gross cost. And it's like this until you reach $8,000 of true out-of-pocket costs, or the TROOP. An important note about the $8,000 TROOP, this is not a cap on prescription drug cost. It's actually a misnomer. In 2024, you'll personally need to spend about $3,300 in co-payments to reach the TROOP. Now, why is that? Well, in the donut hole, you get credit for 70% of the cost of your brand name drugs, which is paid by the drug manufacturer behind the scenes. So that's what makes up the difference between your roughly $3,300 and the $8,000 TROOP. Here's a quick summary of what gets you to the $8,000 TROOP. TROOP is calculated by adding up these 4 items: your cost in the deductible phase, your cost in the initial coverage phase, your cost in the coverage gap donut hole phase, and 70% of the brand name cost in the coverage gap donut hole, which, as I mentioned, is paid for by the manufacturer. Catastrophic is the final phase. In 2024, when your true out-of-pocket costs reach $8,000, you're in catastrophic phase. Remember, that's about $3,300 out of your pocket to get there. Then after that, for the 5% cost-sharing obligation has been removed. This means your prescription costs in 2024 are capped. You will have no copayment in the catastrophic phase for the rest of the year. Keep in mind, You would only deal with the donut hole and catastrophic phases if you take pretty expensive medications. If you experience all 4 phases in Part D in 2024, you will potentially pay 4 different prices for your medications throughout the year. And just a quick reminder, as of January 1st, 2023, your Medicare drug plan cannot charge you more than $35 for a 1-month supply of each Part D covered insulin product. And you don't have to pay a deductible for your insulin. So what's going to happen in 2025? The biggest news is that out-of-pocket drug spending will be capped at $2,000. In addition, your coverage gap phase, known as the donut hole, will be eliminated.
This has been Sonia Jensen here with you today. You want to learn more? Click the button and subscribe below, or visit jenseninsurances.com. Bye for now.